Diabetes and hypertension are two major health problems today. They affect millions of people worldwide. Both conditions can lead to severe health issues. But which one is more fatal? This essay will explore that question. We will look at the causes, symptoms, and treatments of both conditions. We will also compare their long-term effects on health and quality of life. Many people do not realize the dangers of these illnesses. They often go undiagnosed for years. This leads to severe complications down the road. By understanding the risks, we can better manage and prevent these conditions. In this essay, we aim to provide clear and simple information. Our goal is to help you make informed decisions about your health. Let's start by defining what diabetes and hypertension are. We will also look at the different types of each condition. This will set the stage for a deeper understanding of their impacts. Diabetes is a condition where the body cannot properly manage blood sugar levels. There are two main types, type 1 and type 2. Type 1 is usually diagnosed in children. It occurs when the body cannot produce insulin. Type 2 is more common in adults. It happens when the body does not use insulin properly. Hypertension or high blood pressure is when the force of blood against artery walls is too high. It can lead to serious health problems, such as heart disease. There are two types of hypertension, primary and secondary. Primary hypertension has no identifiable cause and develops over many years. Secondary hypertension is caused by an underlying condition, such as kidney disease. Both conditions are chronic and require long-term management. They can lead to severe complications if not treated properly. Understanding their differences is key to managing them effectively. Now that we have a basic understanding, let's explore what causes these conditions. The causes of diabetes and hypertension vary. For diabetes, genetics play a significant role. Lifestyle factors like poor diet and lack of exercise also contribute. Obesity is a major risk factor for type 2 diabetes. Hypertension has several risk factors as well. Age and family history are important. Lifestyle choices such as a high-sodium diet and excessive alcohol consumption also increase the risk. Many risk factors can be managed through lifestyle changes. Eating a balanced diet, exercising regularly, and avoiding smoking can reduce your risk. Next, we will look at the symptoms of diabetes and hypertension. Diabetes and hypertension often have subtle symptoms. This makes them hard to detect early. For diabetes, common symptoms include frequent urination, extreme thirst, and fatigue. Some people experience blurred vision and slow healing wounds. These symptoms can affect daily life significantly. Managing them involves regular monitoring of blood sugar levels and insulin administration. Hypertension is often called the silent killer because it usually has no symptoms. When symptoms do appear, they may include headaches, shortness of breath, and nosebleeds. These symptoms are not specific and can be mistaken for other issues. This makes regular blood pressure checks essential. Both conditions can impact quality of life. Diabetes can lead to complications like nerve damage, which affects mobility. Hypertension can cause heart problems, reducing physical activity. Managing these symptoms requires a disciplined approach to health. In the next section, we will compare the complications of diabetes and hypertension. This will help us understand which condition poses greater long-term risks. Section 5. Complications of diabetes. Diabetes can lead to numerous complications. One of the most severe is cardiovascular disease. High blood sugar levels can damage blood vessels, which increases the risk of heart attacks and strokes. Diabetes is also a leading cause of kidney disease. Over time, high blood sugar can damage the kidney's filtering system. Nerve damage is another common complication. This condition, known as neuropathy, can cause pain and numbness. It often affects the legs and feet, leading to ulcers and infections. In severe cases, this may result in amputations. Eye damage is also a concern. Diabetic retinopathy can lead to blindness if not treated. Managing these complications requires strict control of blood sugar levels. Regular checkups with healthcare providers are crucial. Early detection can prevent many of these severe outcomes. Next, let's look at the complications associated with hypertension. We will see how they compare to those of diabetes. Section 6. Complications of hypertension. Hypertension leads to serious health problems. One main risk is cardiovascular disease. High blood pressure damages arteries, increasing heart attack and stroke risk. It can also cause kidney damage. Arteries around the kidneys may narrow or harden. Hypertension can lead to vision loss. Blood vessel damage in the eyes causes retinopathy. Another concern is aneurysms, which can burst and cause bleeding. Managing these complications involves regular monitoring and medication. Lifestyle changes are crucial in prevention. Section 7. Mortality rates and long-term outcomes. When it comes to mortality rates, both diabetes and hypertension are serious. According to the World Health Organization, diabetes caused 1.5 million deaths in 2020. Hypertension is responsible for even more deaths, causing nearly 10 million annually. This makes hypertension the leading cause of premature death worldwide. Diabetes and hypertension often coexist. This combination increases the risk of severe complications. Long-term outcomes for both conditions are poor if not managed properly. Diabetes can reduce life expectancy by up to 10 years. Hypertension can lead to heart disease, which is the leading cause of death globally. These statistics highlight the importance of managing both conditions effectively. Early detection and consistent treatment are key to improving outcomes. In the next section, we will discuss prevention tips for both conditions. Preventing these illnesses can significantly improve quality of life. Section 8. Prevention tips. Preventing diabetes and hypertension involves lifestyle changes. A healthy diet is crucial. Eating plenty of fruits, vegetables, and whole grains can reduce the risk. Limiting sugar and salt intake is also important. Regular exercise helps maintain a healthy weight and reduces stress. Monitoring your health is another key prevention strategy. Regular checkups with your doctor can catch early signs of these conditions. Keeping track of your blood pressure and blood sugar levels is important. Avoiding smoking and limiting alcohol intake can also reduce your risk. Stress management is crucial for both conditions. Techniques like yoga, meditation, and deep breathing can help. Getting enough sleep is also important for overall health. Next, let's look at the treatment options for diabetes and hypertension. Managing these conditions effectively requires a combination of medication and lifestyle changes. Section 9. Treatment options. Treatment for diabetes involves medication and lifestyle changes. Type 1 diabetes requires insulin therapy. Patients need to monitor their blood sugar levels regularly. Type 2 diabetes may be managed with oral medications. Lifestyle changes, such as diet and exercise, are also crucial. Hypertension treatment often involves medication as well. There are several types of blood pressure medications, including diuretics and beta blockers. Lifestyle changes are equally important. Reducing salt intake, exercising regularly, and maintaining a healthy weight can help control blood pressure. Both conditions require regular monitoring. Patients should work closely with their healthcare providers. This ensures that the treatment plan is effective and adjusted as needed. In the next section, we will summarize our findings. We will also make a final comparison on which condition is more fatal. Section 10. Summary of findings. In summary, both diabetes and hypertension are serious health conditions. They have different causes, symptoms, and complications. Diabetes primarily affects blood sugar levels. Hypertension deals with blood pressure. Both conditions can lead to severe health issues if not managed properly. Hypertension has a higher mortality rate than diabetes. It is the leading cause of premature death worldwide. However, diabetes can also significantly reduce life expectancy. The combination of both conditions increases the risk of severe complications. Managing these conditions requires a combination of medication and lifestyle changes. Early detection and regular monitoring are crucial for improving outcomes. In our final section, we will encourage readers to take proactive steps in managing their health. This can help prevent and manage these conditions effectively. Section 11. Encouraging proactive health management. Taking proactive steps in managing your health is crucial. Regular checkups with your doctor can catch early signs of diabetes and hypertension. Monitoring your blood pressure and blood sugar levels is important. Making lifestyle changes can significantly reduce your risk. Eat a balanced diet rich in fruits, vegetables, and whole grains. Exercise regularly and maintain a healthy weight. Avoid smoking and limit alcohol intake. Manage stress through techniques like yoga and meditation. Get enough sleep to support overall health. By taking these steps, you can improve your quality of life. Managing diabetes and hypertension effectively can prevent severe complications. Stay informed and make health a priority. Thank you for taking the time to read this essay. We hope it has provided valuable insights into diabetes and hypertension. Take control of your health today for a better tomorrow.